if you look at all joints, they kind of have this congruent sort of surface that they meet and they match up with the others. Like, I reckon the best example of that is, you know, your Pringle chips. Yeah, so you know how they're concurved, like they've got those curves? They match each other in, you know, like if you slide them on top of one another, that's essentially, because they're not, our joints aren't flat, they've got like furrows and grooves and bumps, and in order to attain a certain movement pattern, and that shape is very kind of, starts to get you thinking, alright, well, how far can I move this joint without causing any dramas to the capsule, without causing any dramas to the ligaments, and it's something that you start to evolve. So, you know, like if you're going to play around with range of motion of a joint, like just grab out an anatomy textbook and just get a picture of, oh, okay, so how does this joint actually move congruently? Will it match up if I move it in this pattern? And that's a really nice way to do it. There are some other aspects around each of these joints. We've got surrounding tissue. So if we look at the outside, and particularly on an animal, what's the surface that we can see them? Yeah, their fur. So has anyone seen, you know, those white fluffies that come into your clinic and they haven't been, you know, washed, or they're being matted so heavily that their fur is actually kind of preventing them from moving freely? So that's going to be one of the tissues that you'll look at. So how do we free up that joint? Give them a trim. Yeah, and then all of a sudden, oh, wow, I can run again, you know? So that's the first layer. Straight under that, we've got the dermis. So the skin, particularly scar tissue, can make range of motion a little bit limiting. So Bugsy's actually had some surgery here. Yep. So he's had some surgery, and that actually had a bit of an effect on his range of motion at the hip, because the scar tissue, we had to really work hard to actually break down. So breaking down scar tissue using your palpation skills and some of the massage techniques, Tellington touch is really nice. Really, when you're getting specifically with it, you can break away the collagen fibres and make them free again so that they can move, so that the skin surface isn't in contact with the fascia that is overlying that next deeper level, which is what's underneath the skin, do you reckon, and surrounded by fascia, and fascia's going through it. Starts with M. Muscles. Hey! You're on 25 points. So the muscles are the next sort of layer. Now, with the muscles, there's also some really cool things to make them fire, and also to provide them with energy. So there's two systems that are working. We spoke about one just before with regards to the trigger points. You guys, what are you thinking? Anything? you're going, oh, don't ask me. So I'm thinking along the lines, what makes this muscle move? Yeah, close. Well, yeah, the actin and myosin, that's brilliant. Like, that's almost to the next level. But what actually fires from our head all the way down the spinal cord out to a muscle? Nerves. Yeah, nerves. And within the muscle, there are also feedback mechanisms to the brain to tell the brain where you are in time and space. So those nerves going down to the muscle to fire them, to fire those actin and myosin, that's brilliant, Steph. They actually, the point where they attach onto the muscle bundles is where you get your trigger points. So that's that action. If that's constantly firing, then those surrounding actin and myosin chains are going to become taut. and that's what a trigger point is. So does that make a bit of sense? Yep. So there was another system involved in it as well, and it's all about the nutrition. So we've got to get a river of something full of nutrients to it. So what's contained in your muscle? What makes it so gelatinous?
Protein.
Yeah, protein. And to build that protein, we need a river to get there. Yeah, the blood flow. So the blood flow is going to provide it with good energy. It's going to provide it with good nutrition for building and rebuilding and taking away waste products. So, if you've got a muscle working really overtime, like they run for a little bit and then the energy system starts to fade out, but we've got to get rid of all that, the broken product as well. We need that nice level of capillaries and vessels going to and from it. So that's what is surrounding the tissues, but when we get deeper and we look over the specific joint, there's something that I've mentioned that surrounds synovial joints, and it starts with C. Yeah, cartilage is on the end, so it's articular cartilage, but did you say capsule? Yeah, so the capsule is something that is surrounding the bone above and below the joint. So, the capsule has got starts with L as well. Like, you've got fibrous bands, your sprain, yeah. So ligaments, when they are thicker around a capsule, they become a known ligament. So we've got quite a number of them, particularly on the human body, we know where they are. So yeah, it's a bit trickier in the animal because they're a quadruped. So, the anatomy's significantly different, for me anyway. But the one that Elaine spoke of, and I'm sure that you guys would see primarily as well as a pathology, what's the one in the knee that we see in the dog? Rupture. Yeah. The cranial cruciate ligament's quite a common ligament, and it's connecting bone to bone. And what's on the end of the muscles that attach it onto the bone? Yeah, our tendons. So the tendons are the other thing that, all have feedback around, and the tendon is what we're also looking at for range of motion, because we're actually taking some stretch for it, and with range of motion stretching, we're doing it slowly. Everything is slow, because if you try and stretch something really quickly, you're not going to let anything relax at the muscle level. You're trying to stretch the tendons and those connective tissues like your ligaments to a degree. Yeah. Alright, let's go on to the next one, George. Thanks heaps for doing this. Sorry? Yeah. Yep. So the collateral ligaments are just another ligament that are stabilising the joint, yeah, above and below. So they'll run from one side to the next. Yep. Yeah. So this is the other thing to consider with our range of motion. Like, if you look at Bugsy's conformation in comparison to the greyhounds, do you reckon he's going to be as, he's an older dog as well. So we're looking at his, the Labrador. They've got sort of, they're a lot beefier, aren't they, in comparison to our really slender and athletic looking greyhounds. And the greyhounds are fantastic animals to work on because you can see their anatomy. And then you get the little dashhounds, for instance, whose, their flippers are out the front, running along. They're funny. So you take into consideration all of these breed-specific anomalies. So, the conformation of the dog's pretty important to consider. All right, well, his wrists are actually a lot worse than what they were even a year ago. So he's actually starting to get flippers in him himself. But when you look at the greyhound, they're right up on there. So they may not be able to get wrist extension, you know. So that's what I'm saying. Yeah, consider all of these possibilities for how these guys are made up, their breeds, what they're actually trained for as well, like what their drive is. Are they a nervous little sort of, you know, puppy that's wanting to race around, or are they just completely chilled and relaxed, quite passive? And that's going to give you an idea of the abilities of the range of motion that we're playing with. We've already kind of spoken about the joint biomechanics and the neuromuscular components of both the muscle energetics as well as the nerve firing it. So we'll move on. Now, this is really the nuts and bolts of what range of motion is for a therapeutic input. So the first one is, and you guys would probably be going, oh, I'm already doing this, is obedience for dogs, functional movement. What's your first one that you kind of see them do? Yeah. So that is one of your best exercises. Bugsy's had some really bad sort of hip issues. So I've trained him to actually do sit a number of times, and that's built the muscle up. And that's range of motion exercise. Crazy, isn't it? So you guys are already doing this, I'm no doubt. And your next one is, I've actually been able to go, all right, well, I'm going to apply this and get Bugsy in the back of the car. So whenever we turn around to the left-hand side, I really give it to the car so that he has to use a bit more balance, so that he's actually getting range of motion exercises in his balancing exercises for that back hip as again. And they're the... Yeah, that's me. I'm the one that Elaine yells at. Alright, so the next one is active range of motion. So this is where we start to get the animal performing, but we are actually focused in on a specific task. So here we go. Bugsy is going to be coming, hop up. Good boy. Alright. So this is active range of motion. And what do you reckon that's active for? What am I got him doing? Yeah. So he's stretching the thoracic rib cage. So here we go. And he's going, yeah, that's it. Over this way. So that's a really great one for being able to do it. And what's this one, do you reckon? So I'm getting a little bit more like, yeah, good work. You don't want to chew it, do you? You want it all. Good boy. So these are called baited stretches, and baited stretches are fantastic for thoracic, lumbar regions. But watch this one. Here, buds. Here. What's that? So that's his. Yep. What's this? Still cervical area. Yep. Good boy. And over here.
So with your terminology, you'll be writing on your form, bait to, this is homework for the owner, baited stretches, and when you're doing the ventral neck, you can do ventral in the midline, and you can do ventral lateral, left and right. So that's how you can be clear in what instructions you've given the owner to do.
Awesome.
And when you get back to the vet, you learn from one of the best physiotherapists. These are the stretches.
So they are fantastic for, you know, like the tight sort of stretches that are needed for the thoracic cage, particularly trapezius through that area. Like the neck is a really good one, but you know, like you're only limited by your imagination with this sort of stuff. Then what we've also got, Bugs, come here, mate. Go on.